Assalamu alaikum rahmatullahi wa barakatuh, and good evening to everyone joining us from around the world. Welcome to our special Health at Hajj webinar brought to you by CBHUK in partnership with the Muslim Doctors Association and the Saudi Medical Academy for Volunteering and Hajj Guides UK. Tonight, our panel of expert physicians will share essential advice on staying healthy during Hajj, covering physical preparation, infection prevention, chronic disease management, and more, and absolutely more, followed by a live Q&A session. So you could use the Zoom chat facility at any point to submit your questions, and we'll collect them throughout the presentations and address as many as possible at the end, inshallah. So, as we know, Hajj is one of the 5 pillars of Islam and the ultimate journey of faith. It demands not only spiritual readiness, but also physical and mental resilience. The conditions of Hajj are where we have long walking at distance, crowds, heat, and changes in routine, and it can pose significant health challenges. But being well prepared and informed helps ensure that our worship remains spiritually uplifting rather than physically exhausting. And that's why tonight's focus on preventative care, chronic disease management, and emergency awareness is so vital. So, today I'd like to begin before we introduce our panel. It's my pleasure to invite the founder of CBHUK and moderator for tonight's webinar, Mr. Rashid Mohammed, to say a few words. So, Rashid, over to you.
Assalamu alaikum wa rahmatullahi wa barakatuh. Thank you, Tasnim, for that intro. And a very warm welcome to all our aspiring Hajjis this evening. And a very warm welcome to our panelists of medical experts as well. Thank you for their support. It gives us immense pleasure to be in the service of the guest of Almighty Allah. And alhamdulillah, we've been running these webinars and seminars since our establishment in 2006. There's not much for me to really say about the health webinar, other than that it's probably one of the most significant webinars that you'll be attending, and the tips that our experts will be sharing this evening will be something that will either make or break your Hajj, and quite literally so, because if you are not in the best of health and you're not managing your conditions, then the journey of Hajj, not only is it demanding, it could become very, very painful as well. So we're here to ease that and give you the guidance. Between us, we have a number of years of experience on the ground, and we'll be happy to share that as well. So enough from me, and I'll hand it back over to Tasnim. But please do use the chat facility. We'll be moderating the questions, and then once the presentations are done, we'll be addressing the Q&A, inshallah. Thank you.
Jazakallah khair, Brother Rashid, for your warm welcome and your tireless leadership in supporting pilgrims' health and welfare during Hajj. Now for the first presentation, it's now my honor to introduce our first speaker of the night, and that is Dr. Hina J. Shahid. Now, Dr. Shahid is a GP based in London with a background in public health and medical education. Her clinical interests include women's health, paediatrics, and elderly medicine. She also chairs the Muslim Doctors Association and Allied Health Professionals CIC. Dr. Shahid will share key insights on pre-Hajj medical screening, vaccination protocols, and how to tailor care for vulnerable groups such as elderly and children. So please join me in welcoming Dr. Hina J. Shahid, and I'll hand it over to Dr. Shahid now.
Assalamu alaikum. Thank you so much, Tasnim, and thank you, Rashid, for having me today. Can we get the slides up?
Allow me a second. And just as we go into slides, you can follow us on our socials, and we'll be posting resources not only to this webinar, but to other helpful tips and advice as well. So follow us on our socials. and use the chat facility for the Q&A as well. Over to you.
Thank you very much, Jazakallah khair. As Tasnim mentioned, I'm a GP, and I also had the privilege of performing the Hajj in 2019. And it was one of the most spiritually life-transforming experience, but also, as has been mentioned, it's also very demanding, both physically and mentally. And so good preparation is really important. That's why we're having this webinar today. So I will spend a few moments going through how best to prepare before you go on the Hajj, and then we'll hand over to colleagues who will speak more about what to do if issues arise during Hajj and how to prevent those problems as well. So the first thing that is really important for anyone to consider when they are thinking about going to Hajj is to make sure that they are up to date with any of their general checkups, and that includes routine blood tests. And this becomes even more important if you have any underlying health conditions, long-term conditions, and that includes things like high blood pressure as well. So please make sure that you do consult your GP on any necessary adjustments that might be required to your medication schedules or any tests or assessments that may need to be done. And if you have more serious conditions and are under the care of a hospital specialist, then it's really important for you to make sure that you discuss your plans to go on Hajj with your consultant, and make sure that you have the contact number of the consultant or the team that looks after you as well. Next slide, please. So if you are on any regular medication, make sure that you take enough supply with you. You can ask for extra supplies if needed from your GP if you are going for an extended period. Make sure that you know where to pack your medications as well, and it's in your hand luggage, not in your suitcase. And remember that there are some medications that are unavailable in Saudi Arabia. So even if you forget to pack your medication, you may not be able to get that when you arrive in Saudi Arabia. Similarly, there are some medications that are, especially if you're on controlled drugs, that you will need a special letter to make sure that you're allowed to carry them. So if in any doubt, just check with your travel, your airline or your Hajj organizer to see whether or not you need any documentation. If you have diabetes, make sure that you do stock up on any snacks, and that if you take insulin, that you have enough that is in date, and you take extra supplies as well. And if you have any personal medical equipment that you need, so for example, if you have hearing aids or breathing aids, and make sure that you have any supplementary batteries and extra supplies of masks or whatever that may be necessary. Next slide, please. Also, make sure that you are vaccinated, and you need to make sure that you have the correct vaccination. So the meningitis ACWY, and the one that is now being given is Menveo and Imurex, which is valid for 5 years from the date of immunization. And you need to present the certificate of immunization at departure, so make sure that you get not just a certificate, but definitely get the vaccine. And also, in addition to the meningitis ACWY vaccine, it's recommended that you are also up to date with other vaccinations such as seasonal flu, pneumococcal, hepatitis A and B, tetanus, and COVID-19, if you are not up to date with these already. Next slide, please. And a few other things just to bear in mind. So if you use any mobility aids, then please make sure that you take your own. Don't count on them being available when you get there. So any wheelchair, walking sticks, if needed, please make sure that you pack these. Sun umbrellas with UV protections is absolutely essential. Light colored clothing because it gets very hot. Breathable fabrics, ideally. And loose fitting, unscented sunscreen, and make sure that you prepare in advance. So that means exercising, going for walks daily. Now the weather is generally nice. We have some odd days here and there, but do make sure that you try and get your physical activity in before, because it is hard. You know, you will end up doing tens of thousands of steps over several days, and so it is important that you're prepared for that. If you are completely inactive and sedentary, then it will come as a shock to your system. So please make sure that you do prepare in advance. So gentle walks daily is what would be advised. Next slide, please. Purchasing good fitting sandals and footwear and breaking into them beforehand is absolutely essential. It's really common to get foot so blisters if you are not wearing good footwear. That then risks infection. So make sure that the footwear that you wear is comfortable and that you have had the opportunity to break into it well before you travel. If you have glasses, then make sure you take an extra pair of glasses, that's prescription glasses, and also make sure that you take sunglasses as well. And if you have any dental issues, please make sure that you get them sorted before you travel. So make sure if you haven't had an up-to-date dental appointment that you do book an appointment with your dentist as well. Next slide, please. And then for women's issues, what the commonest issue that we see in women of childbearing age is the question around taking medication to delay periods. And unfortunately, every year what we see is that women will take medication, but they may not take it as prescribed, and then that medication doesn't work. So they have some we call breakthrough bleeding. They then take advice from a sister who then adds in another tablet, and then they might take advice from another female GP who adds in another tablet. This doesn't work, and then it's all a mess, and then this ends up with seeking help from a sheikh for advice, and this can create a lot of anxiety and mental health problems. Next slide, please. So if you are a woman of childbearing age and you have, you are having periods, then it's important to see your GP well before you leave to make sure that all the options are discussed fully with you. There are several options that are available, and obviously they need to be tailored according to your medical history as well. So don't leave it for the last week or 2 weeks. Try and see your GP well in advance. So I would say try and make an appointment now to see your GP if you can. And when you are given a prescription, please remember to take the tablets with you. It's not unheard of for women to leave their tablets behind because of the rush of all the packing. So make sure that you do pack your tablets. Pregnancy. So we do get queries, and we have had a query this year as well. If you're pregnant, what to do? The first thing I would say is consult your doctor to see what the risks are to you in general. My advice as a GP would be to, if possible, to try and delay the Hajj if you are pregnant, because we do know that if you're pregnant, then you are at an increased risk of having adverse outcomes from pregnancy, both to yourself and the baby. And so, if you can, do consider delaying it. However, having said that, there are women who do go on the Hajj who are pregnant, and they have perfectly healthy babies. I do also recognize that if you have booked, it's very difficult to cancel. If you find out between now and your departure that you are pregnant, it will be difficult for you to cancel. And what do you do in that instance? I would say please see your GP or speak to your midwife to see what extra measures can be put in place for you to support you during the Hajj. Other issues to think about are if you are undergoing menopause and you are taking patches. So especially if you are using patches for HRT, just make sure that they are secure, because it can get very hot and sticky, and it's easy for them to slide off, and then you may not get the hormones, and you might end up having a breakthrough bleed. So just make sure that they are secure and they're not slipping. Urinary tract infections as well can be a risk, especially if you are not drinking enough water. So we recommend in general to be drinking 2 to 3 liters of water a day, and the dehydration can be a risk factor for urinary tract infections. And also some women may want to hold going to the toilet, and that is not advisable, because again that puts you at risk of urine infection. If any difficulties arise when you're in Saudi, then please ask for help. And we do have colleagues here from the Saudi Medical Academy, volunteers who will be talking a bit more about the healthcare system in Saudi Arabia should problems arise. Next slide, please. So medical insurance, luckily all Hajj pilgrims receive free medical insurance and free cover with their Hajj visa. And this entitles them to free treatment at any Saudi government clinic or hospital in Mecca and Medina. That's just a reminder that you will be covered, inshallah. Next slide, please. And mental health, that we know that the Hajj can be quite a stressful time, the preparation leading up to it. You know, I remember myself thinking about the various things that need to be done. So please make sure that you do reach out for support. A lot of Hajj operators do have, you know, they create WhatsApp groups for you to connect with other people in your group. So please do reach out to the organizers, to other people in your group, to people who may have been on Hajj before as well, to get their advice and guidance as well. You know, it is one of the most rewarding journeys and experiences of your life. And despite some of the difficulties that, you know, it is challenging, but it's definitely worth it. And inshallah, I pray all goes well for all of you.
Thank you, Dr. Shahid. That was really invaluable guidance and advice there that I think a lot of the panelists can really benefit from, and those attending. So thank you for that. Now we've got our second presentation by Dr. Mohamed K. El-bayouk. Now, Dr. Mohamed K. El-bayouk is a British Palestinian physician working in Brighton. Dr. El-bayouk gained first-hand Hajj medical experience in the cardiac care unit at Al-Noor Specialist Hospital in Mecca during the 2024 season, where he served hundreds of pilgrims alongside international medical teams. Now, he's here to speak about acute care challenges on the ground, such as heat exhaustion, dehydration, and cardiac emergencies, and share practical tips for pilgrims and volunteer teams alike. So please welcome Dr. Mohamed K. El-bayouk, who's going to be presenting now.
Thank you very much, Sister Tasnim, and thank you very much also to everyone involved at CBHUK and to Dr. Hina and Dr. Mohammed that are also part of this panel. It's an absolute honor to be speaking to the guests of Ar-Rahman, the Most Merciful, those who are chosen, bi'idhnillah ta'ala, to complete this blessed journey of Hajj. And as Dr. Hina already pointed out, we ask Allah subhanahu wa ta'ala to make it easy for you and to allow you to complete this amazing pillar of Islam with full success. So inshallah, if we just get the slides up and we'll begin the presentation. Okay, inshallah ta'ala. So when you're at Hajj, as you know, it's perhaps the most unique gathering of human beings on earth, and it's the one gathering where you have millions of people from all around the globe coming from every corner of earth, and they're all there for one reason, which is to complete this pillar of Hajj. Now, as you know, the way Hajj is done, there is certain aspects of it, tawaf, sa'i, so on and so forth, and this means that the Hujjaj will be in very close proximity to one another. And as is inevitable, things can pass on, microbes can pass on from one person to another when they're in such close proximity. So what is very typical of most Hujjaj to catch is what is described as Hajji cough. And typically this is just a very bad upper respiratory tract infection. It's often viral and spread by droplet means. So typically the symptoms are symptoms of flu. So you'll have a very bad cough. You will potentially have fever. You'll have muscle aches. You'll feel very fatigued and tired. And this is very typical of what we describe, as I said, as Hajji cough. So just as the symptoms are similar to flu, the management is also the same. So that essentially means resting, making sure that you get enough rest, having plenty of fluids, paracetamol for fever if necessary, and essentially it's really a matter of time. So Unfortunately, it does tend to last a few weeks if you do get it, but it's one of those things that, to a certain extent, is somewhat inevitable. Now, because it is spread by, means of droplet infection, so what we mean by that is sneezing and coughing near other people, then it can be limited with good hygiene. So, as the NHS in its famous motto teaches us, catch it, bin it, kill it. So try as much as you can, and this is actually from the sunnah of the Messenger sallallahu alaihi wasallam, that if you are to sneeze, then cover that sneeze. If you have a tissue, try and catch your sneeze in a tissue. If you don't, then catch it with your elbow. Just make sure it's not at anyone directly or just out in the open. And once you do catch it in a tissue, then make sure to safely dispose of it. And after that, make sure to wash your hands as to get rid of any potential microbes that are there. Remember that that's your responsibility towards other Hujjaj, but likewise, you would want that you would want other Hujjaj to do that to you as well. So, inshallah, if you do that, not only will you be rewarded, but inshallah, you'll prevent any form of struggle to your fellow Hujjaj. Thank you very much. Next slide, please. So just before moving on, these are some emergency contacts that you might want to screenshot or just make a note of. So 977 is the number for the Red Crescent. That's essentially the ambulance service that is present in the kingdom. You have a specific call center service for pilgrims at 937. The police can be contacted on one of two numbers, 999 or 911. And the Ministry of Hajj and Umrah has its number, as you can see. If you need, for any reason, to contact Nusuk, the Nusuk platform, then its number is also there. If you have matters that relate to the consulate or needing to contact them for any reason, then that's their number as well. Of course, your individual Hajj guide. So at this point, or maybe a little bit later, you should be in your own groups with your Hajj provider. They should provide you with the contact details for them. And they will also be present on the Nusuk Hajj card that you'll receive once you arrive in the kingdom. Next slide, please. So, as Sister Tasnim rightly pointed out right at the beginning of the webinar, perhaps the greatest challenge facing Hujjaj is the heat and the sun in the kingdom and what you'll face. There's a couple of reasons for that. Number one, because currently Hajj is taking place at a very hot time of year. So I believe this year will be at the start of June. So it's right in, when it's hottest in the year. That's number one. Number two is that, of course, especially for men, when you're in a state of ihram, you're unable to cover your head. And so that means covering it with, a scarf or a hat. And that means you're more directly exposed to the sun than perhaps you would be if you were wearing such attire. And of course, us who have, lived in the UK for the majority of our lives, it's a big jump going from 10 or 12 degrees to temperatures above 40 and even 50 at times. So a person is at risk of what we describe as heat exhaustion. Now, the symptoms of that, just so you're aware, include dizziness, headaches, your skin may become clammy, you can begin to start feeling sick and potentially be sick, and also you may develop muscle cramps. But really, what it is that your body temperature is rising as a result of the heat around you and being exposed to sun for a long time. Now, a person could develop confusion, and at that point, that's when it gets really serious and it's moved more so onto heat stroke. And if the body reaches temperatures that are very high, then this can lead to loss of consciousness or even seizures. And what you typically find is that the person's skin is very hot, yet there's no sweating. Now, if as soon as you find someone experiencing those symptoms, or you yourself are experiencing such symptoms, then you need to act very, very quickly so that it doesn't develop further and become more dangerous. Essentially, what you need to do is just cool the body down as quick as possible. And the best way to do that is get out of the direct sun. So find yourself some shade, or move whoever you're with into some shade, and try to cool down their body by any means possible. So whether that be through cold compresses, or if you have water with you, use that, whatever it may be. But you need to cool the person down as quickly as possible. And of course, it goes without saying, seek urgent medical help. And alhamdulillah, the kingdom provides many medical volunteers, and they'll be dotted around everywhere you go. So just seek help as soon as possible. Thank you. And once again, this is just to reiterate the last slide. So these are the same symptoms we spoke about: muscle cramps, high temperature. Once you notice changes in cognition, so confusion or aggression even, or the skin is becoming very hot yet dry, that's when it's really serious and really concerning. So like we said, move to a shaded area, call whoever it is, whether it be yourself or someone nearby, call them down as quickly as possible and seek urgent medical help. Thank you. Now, the other problem with being out in the sun and in a very hot climate is that a person becomes dehydrated. So dehydration is essentially a result of a few things. Either you're not having enough fluid intake, or the fluid that your body is losing is much greater. And of course, you're going to lose it through sweat, particularly in a hot environment like that. Now, if the environment is very hot, then the fluid loss per hour can reach up to 1 liter, which sounds a lot, and it is, but that's what can happen if the conditions are indeed that hot. Now, as you know, and you may have heard this advice during Ramadan as well, when you lose fluid through the body via sweat, you're not just losing water, but you're also losing key salts, key minerals. And so it doesn't make sense to replace that with water alone. You need to be replacing that with water and also the same electrolytes that you lost. So you can find, these electrolyte sachets at local stores here in the UK and even in Saudi. And I would highly recommend that you, add those sachets to your water to make sure that you're not just topping up on the water that you're losing, but also the key electrolytes. And like Dr. Hina mentioned, the idea of I won't drink too much because I don't want to use the toilet that much is a very silly idea. We would definitely advise against that. The reality is your body loses most of the water content through sweat anyway. So make sure to drink as much fluid as possible, and it's never too much, essentially, in a climate like that. Thank you very much.
Sorry for the note. Carry on. Sorry, I thought it was the presentation, but no, please do carry on.
No problem, inshallah. So these just are some more further tips for pilgrims. So always use an umbrella, as Dr. Hina mentioned, again, to help avoid direct exposure to the sun. And avoid going out in the middle of the day when the sun is at its peak. So, and thankfully the authorities at Hajj, they work around this. So last year, for example, in some of the days in Mina, there was a general advice to not go out, I think from midday all the way up until about 4 p.m. because of how hot it was and how strong the sun was at that time. Drink more fluids and stay in the shade where possible. There's lots of shaded areas that are provided, but ultimately you will have to walk in the sun at some point. So make sure that you're well equipped with an umbrella and staying regularly hydrated. Next slide, please. And this is just a graphic to show you the distances that are involved in the journey of Hajj. And of course, some of these distances are, you'll be helped with, coaches that are provided based on the package that you bought. But on some of these days, for example, the day of Eid, Al-Hajj al-Akbar, because of the sheer amount of people going from Muzdalifah all the way to Mina and some back to Mecca to perform Tawaf again, it's simply not feasible to provide coaches on that day. And so, you could be walking very long distances. So the same advice that Dr. Hina gave, we just reiterate, is that make sure you're wearing very comfortable sandals, that you've worn into them already before your departure, and that you're not walking, distances unnecessarily. So, for example, the tawaf that is done after after the day of Arafah. This tawaf can be done. It doesn't need to be done on the day directly after Arafah, i.e. on the day of Eid. It can be done on the days after. So if it would be too physically burdensome for you to do it on that day, then alhamdulillah, the deen gives us sa'ah. There's no need to burden your body in such a manner. So that's just a nice graphic to appreciate. Next slide, please. Now, on the note of foot care, because of the long distances that you're walking, it's very likely that your feet may swell, you may develop blisters, so on and so forth. So whenever you can, whenever you get a moment of rest in Mina or elsewhere, keep them elevated. Try and have moments of rest. If your skin is very dry, then try to moisturize it daily. Definitely avoid walking barefoot. On the tarmac outside, you're very likely to get burnt because of how hot it is. You could easily get injured. And also, even during or inside the camps, there's always that risk of athlete's foot. So try and always be wearing some type of footwear wherever you are. Of course, you want to avoid materials which rub on the skin. You can use talc powder. And if there's ever a time when some small stones or sand make their way into your footwear, then make sure to remove them, because over a long period of time, they'll rub in and cause you a bit of problems. So what are you going to do about that? You're going to clean the area, apply a firm plaster, and like I said, elevate the feet and rest whenever and wherever possible. Next slide, please. And this one is more so directed at the brothers because they're in this ihram clothing. It's very common for sweating and rubbing of the thighs to cause an itchy rash in the groin area. And it's a very simple fix. Just use Vaseline or any anti-chafe cream for prevention and also for relief. And given the rules of Hajj, then make sure it's unscented. This is a very simple fix. Next slide. And again, just to reiterate the point that Dr. Hina mentioned, so Hajj, subhanAllah, is a very, very physically demanding journey. It's also a very spiritually and emotionally demanding journey. You know, you will be, and this is the sort of message that Hajj itself signifies. You're leaving everything behind. You're leaving your family behind. You're leaving your business or your job behind. You're leaving your loved ones behind. You're leaving your familiar environment. You are wearing clothing that you wouldn't typically wear. You're in a very hot environment. It's very difficult with the heat and the sun. You're in shared rooms, whether it be in your hotel back in Mecca or Medina, or during the camps. And that means that, you know, you're with your Muslim brothers and sisters that you've not met before. You know, different people have different routines, different levels of hygiene, different levels of you know, consideration. So someone might be on the phone while you want a bit of rest. Someone could be snoring a bit loud. All of these things are, you know, things that can be a bit burdensome on us. And if they are added one on top of the other, then it can pose a bit of a challenge for a person's mental health. So what we would advise is have patience, have sabr, make lots and lots of dua before you go for Hajj, during Hajj and after Hajj. And always remind yourself of the intention, why you're there, what it means to perform Hajj and to achieve that status of completing a Hajj Mabrur. You know, seek assistance in that. And of course, seek support from your Hajj guides, the other people around you in Hajj, the wider community, and also the numbers that we gave you access to earlier. Next slide, thank you. And this is just a quick pointer towards some of the facilities in Mecca. So in the Haram, you have, by door number 5, the Ajyad emergency hospital, and you'll see it by the Safa Towers. It'll become very apparent once you're there, and you'll see it. It's, you know, there's a nice big red sign. You'll see it there. So if you do require any medical attention whilst you're in the Haram, then that's an appropriate place to go to. And of course, Mecca is dotted with many, many different hospitals. Like we mentioned, the hospital that I spent some time at last year is An-Nur Hospital. It's the main hospital in Mecca. And it goes without saying, mashallah, the people of Mecca and at large will take very good care of you medically and beyond that. And during the period of Hajj, it's actually a period of murabata for the medical doctors. So you have thousands of doctors from all around the kingdom coming for the period of Hajj, and they spend 15 consecutive days working 12-hour shifts just to serve the Hujjaj. So you're taken very well good care of. Just make sure to seek help when you need it. Next slide. And just finally, just to conclude on a note, once again, congratulations to you all for, inshallah, being chosen to complete this journey. Like Dr. Hina said, Hajj is an experience of a lifetime, and it's something that, if done, well, then it's a life-changing event. So with good preparation, inshallah, and planning, things will go smoothly. And we, of course, take preparations and we take provisions. And Allah, as Allah subhanahu wa ta'ala says in the Quran regarding Hajj, وَتَزَوَّدُوا فَإِنَّ خَيْرَ الزَّادِ التَّقْوَى, that seek provisions, take provisions. And that's, inshallah, what we're advising you to do with this talk. But remember, the best of provisions is the taqwa of Allah Azza wa Jal. So take your provisions, but rely solely on Allah, and inshallah, Allah subhanahu wa ta'ala will bless your journey and make it an easy and fruitful one. And as always, please remember us in your du'as, and we ask Allah subhanahu wa ta'ala to accept from us all. Thank you.
Jazakallah khair, brother Dr. El-bayouk. That was a very insightful and very beneficial presentation, mashallah. And we're going to be now moving on to our next speaker, who, again, all the presentations tonight, mashallah, by Dr. Shahid and Dr. El-bayouk have been wonderful, really insightful, and we've got some good feedback from the attendees. And I just want to remind everyone that if you have a question, please use the chat facility that we have on the webinar to submit your questions, and our panelists can take some questions at the end of the sessions, inshallah. Now, moving on to our next speaker, we have Dr. Mohamed Boussard, a public health physician and epidemiologist specializing in chronic disease prevention and community health promotion. He earned his Dr. PH in epidemiology from the University of Pittsburgh and an MPH from Johns Hopkins University, where he completed a postdoctoral fellowship. Now, Dr. Boussard serves as a scientific member of the Saudi Medical Academy for volunteering and has led mass gathering health strategies for Hajj. Dr. Boussard will discuss infectious disease prevention, crowd management protocols, and the role of volunteer health services in safeguarding pilgrims. So please join me in welcoming Dr. Mohamed Boussard.
Assalamu alaikum, everyone. Let me try to share my slides here. Okay, assalamu alaikum, everyone. Thank you for giving us the opportunity to be with you here today. It is a pleasure and honor to be with you here today, and it is always a pleasure and an honor to serve the guests of Allah. May Allah make this journey smooth and easy for you and accept your good deeds. Ameen. So actually, it is hard to talk after my colleagues, Dr. Hina and Dr. Mohammed. I guess they did a wonderful job covering most of the important topics, but we might be reiterating some of the things and go over them again and from different aspects. So as you all know, Hajj is a great journey that involves the hearts, tongues, and limbs of the pilgrims, and it is also a physical and financial form of worship. So just as the Hajjis spend their money on it, they also exert great physical effort in it. And for that reason, one of the conditions of this obligation is physical ability. So those who are not able to perform Hajj themselves are not obligated to do so. And as it is a unique journey and experience, pilgrims must take care of their health as much as they can so that they can perform their worship to the fullest, inshallah. So we'll go over some of the common medical conditions that are usually faced by Hajjis. Inshallah, you don't face any of them and you don't have to go through any burdening moments. So as Dr. Hina pre-Hajj, it is important that you make sure that you got all the required vaccines. And for those people with the chronic diseases, it is also important that you consult your doctor, make sure that stability of your health condition and your ability to perform Hajj without any difficulties. And for people with diabetes, you can also talk to your doctor about any need of adjusting the dose of the medication during the Hajj period. Also, ensure that, as Dr. Hina mentioned, ensure that you take sufficient amount of the medications, especially if you have some chronic conditions that require you to take continuous medications, such as people with heart conditions, high blood pressure, or diabetes. And just in case you face any troubles with your flight going back to UK or any delay in that, so you have sufficient amount of that. In this regard, it is also important that you carry a detailed report explaining the diseases or the health conditions that you are having, what kind of medications you're taking, what doses, just in case you need any medical help. That would make it easier for the health providers to know about your condition and deal with it as necessary. Pharmacies are everywhere. They're located around the sacred mosque, but there are no pharmacies in Mina, Muzdalifah, and Arafah, so just take that into consideration. And as Dr. Mohammed mentioned, the health and emergency centers are all over the place. You can find them, inshallah, easily, in addition to those people volunteering to provide the medical services in the field in case anything is needed. And something also to keep in mind before coming to Hajj, it is that physically demanding journey. So it is good that you work on increasing your physical fitness before that. Maybe it is possible for you to do some aerobic exercises, try to increase your fitness and exercise maybe 20 minutes every day, just getting yourself prepared for what's coming. Keep it gradual, take it easy on yourself, and always take into account warming up before you start your physical activity and cooling down before you complete it. As we all know, heat stroke is a major health condition that many people face, but inshallah, with taking the proper precautions and preventive measures, that's not going to be an issue for you. But as you all know, and as Dr. Mohammed mentioned, Hajj coincides with the summer season, so it gets very hot on these days. And heat stroke is life-threatening condition that usually associated with uncontrolled rise in the interior body temperature above 40 degrees Celsius degrees, and which can be reflected on some deterioration in the nervous system manifested by delirium, confusion, or coma. So make sure that you don't get direct exposure to the sun and high temperatures or get dehydrated as much as you can. So someone might be asking how to prevent this heat stroke from happening to anyone. So always keep in mind that you need to stay hydrated, drink water regularly, and keep your body hydrated. Avoid direct exposure to the sun in the peak times of the heat, so from 10 to 3, and also listen to your Hajj guides in case they are notified of any news or something that they need to take into account. Using the umbrellas and wearing light clothes is good. Also keep in mind that the color of the umbrella can make a difference, so avoid having dark colored umbrellas, as the white colors can help in reflecting the heat of the sun. Throughout your Hajj journey, make sure that you find some shaded areas and air-conditioned ones to take some rest throughout the journey. And just in case you have any signs, these can be considered as warning signs: having headache, dizziness, or fainting, or some confusion, red and dry skin, palpitation or rapid heartbeat, and vomiting or sense of confusion. All of these are considered to be warning signs, so just take that into account. And how to deal with it: it is a health condition that require medical attention. So quickly try to move the patient to a cool place. Remove the outer clothing, cool the body with water, especially the neck and the face area, and expose the body to an air source. Give the patient some fluids to keep them hydrated. And if these symptoms continue or there is no improvement in the patient's condition or the Hajj's condition, make sure that you seek medical help before it is too late. May God forbid that. Also, another important health condition is food safety, and this is very common. Food poisoning is a very common health condition in Hajj, and that's why Saudi authorities try to prohibit bringing food from with the Hajjis or pilgrims from outside, except if they are canned food with for personal use and are being brought in small quantities and in containers that make them easy for the authorities to inspect. These food poisoning conditions are usually caused by improper storage or handling of the food, especially during long outdoor stays. And how to avoid that. Here are some tips. Avoid food from street vendors, exposed foods, something that has been sitting somewhere unrefrigerated for more than 2 hours. Make sure that you wash the fruits and vegetables before consumption. Always keep your hands clean. Washing before and after meals is also necessary. So for the infectious respiratory conditions, we know it is going to be crowded everywhere. So that makes people at an increased risk of catching some respiratory illnesses. And viruses can spread via through coughing, sneezing, and touching contaminated surfaces. So try to avoid unnecessary touching of services, because you don't know what can be there with all of these numbers and crowds. How to reduce the respiratory risk? Make sure that you always wear a face mask, especially in these crowded environments. Washing hands frequently with soap and water is also important. Using the hand sanitizers, the unscented ones, is also recommended, especially when you don't have access to soap and water. Avoiding touching the face after touching other services is good to keep in mind. Also, here is some important topic to cover, especially for shaving and trimming. We know that it is one of the acts of Hajj commanded by Allah. It takes place after ending the Umrah and after stoning the Jamrah of Al-Aqaba on the day of Eid. And here we will talk about some instructions and tips that you can follow for your own safety and protection from infectious diseases. So keep in mind that you ask the barber to wash his hand with soap and water before starting. Also, make sure that the barber uses disposable razors and not something that has been used before with other people, and they get them changed every time they deal with a new Haji. Avoid sharing any kind of razors or any shaving materials, and because as we know, used razors can put the Hajis at an increased risk of contracting infectious diseases. And most dangerous thing here is hepatitis, especially if someone gets wounded from these sharp tools. Personal hygiene and clean living is a key, so always keep that in mind. Keep your sleeping area clean, using tissues coughing when coughing or sneezing, and dispose them properly. Maintain oral and body hygiene on daily basis, and make sure that you do physical distancing. It might be hard to do that, especially when it is crowded, very crowded, but do your best in this regard. Avoid the overcrowded times for rituals, early morning, late evenings. At the same time, listen to your Hajj guide. Don't shake hands or hug unnecessarily. I know we tend to do that over and over, and it is, you know, an act that brings a lot of feelings between brothers and sisters. But during this Hajj journey, maybe we need to be cautious and keep it to the minimal, keep safe distance while walking or queuing in public places. Just in case you need some emergency numbers, here are some. So 911 for emergencies and security services. As Dr. Mohammed, I think, shared 937 for any medical help or consultations. And you'll find people listening to your complaint and answering you in your own language. And then you have the number for the Ministry of Hajj and Umrah. And in case you need anything, if you're going to Medina, then there's this 1966 number. You can reach out to them and get your questions answered. Also, I'd like to highlight this application called Sahati, or like My Health. And this is a website for an application for the Ministry of Health. You can get many services there. You can also have a tool that help you find out the nearest health center and hospital around you. Here down in the slide, you can find the website for their webpage. And also, if you download this application to your phone, you can use it all the time to locate any services, or in case any notifications are coming up, you can stay updated. Also, there is another website, which is for the Ministry of Hajj and Umrah. It is also good. They have a lot of guidebooks in different languages. I can share some of the materials with the organizers here, so you can use it. Even if you have a brother or sister whose main language is not English, they can find the Hajj guides in many languages, just to make it easy for the readers. As my colleagues mentioned before, this is a once in a lifetime journey. So make sure that you get prepared for it, do it in the best way, practice it to the fullest, and take care of your body, stay aware of the surroundings, help your brothers and sisters, and may your Hajj be accepted and good deeds, inshallah, be accepted, and you have a safe journey, inshallah. That's it for me, and thank you very much.
Thank you very much, Jazakallah khair, Brother Dr. Mohammed Bussard, and Jazakallah to all our speakers who've given really beneficial and insightful presentations about health at Hajj. And may Allah bless everyone to fulfill this obligation, inshallah, and especially when it's unprecedented for many of those who are going to Hajj for the very first time. So all these advice and guidance is, you know, very, very beneficial. Now we'll be handing over to a live question and answer session where we'll be taking questions from you all, from the attendees, and we'll be having them answered by our panelists, inshallah. I'm going to actually start off the question answer session and actually direct it to our brother Rashid, because he has obviously been on Hajj many times as well. So brother Rashid, if you're there, I do have a question that's come in to start it off, and then we'll hand over some questions to the panelists. Don't know if Brother Rashid can hear me at the moment.
Yes, go for it.
Yeah, so a sister has asked, I know sometimes UV umbrellas are given to Hajjis once they get there. Is this going to happen to us, or should we bring them from the UK?
It depends on the provider. Sometimes you get them, sometimes you don't. My advice is always be prepared. So as I do, I just take one from here and make sure it is a UV protected umbrella, because that will actually protect you from the UV rays as well. Otherwise, it just becomes, if you just use a normal umbrella, it becomes like a little greenhouse effect, and you get really hot and flustered as well. So get the equipment from here if you can. I can see some questions here, if I may, Tasnim. Somebody is asking, is it advisable to perform Hajj with a frozen shoulder, which is causing pain and discomfort. I'll pass this over to Dr. Boussad on this particular matter. Does a frozen shoulder, is that enough for somebody to not perform Hajj?
Well, I think that depends on the condition, how bad it is, and maybe I actually, it is hard for me to answer for someone unless you see the patient or the person in person. So maybe it is good that he gets back to his treating physician, gets seen before going through the Hajj journey. I can see also Dr. Hina and Dr. Mohammed here. Maybe they can answer to that. Seems that they have something to add here.
Dr. Hina?
Yeah, sure, I can answer that. So, like you said, Dr. Boussad, it does depend on the severity, so how much pain it's causing, what the restriction in movement is. So, I mean, if frozen shoulder can be on a huge spectrum, so it can be mild. You may need to take, the odd painkiller here and there. But if it's persistent, if you're getting daily pain, then it probably may not be a good idea for you to participate in the really physically demanding rituals that Hajj can entail. But I would definitely discuss this with your doctor and see if your medication can be optimized, if you could be referred for injections or physiotherapy, before you're able to travel. But it really does depend on how much it is limiting your abilities, because Hajj is a physically demanding experience, and so you don't want to make anything worse.
Great, thank you for that. Dr. El-bayouk, I've got a question here. How do you complete your Hajj if you get Hajj cough?
So once again, I think our answers are going to be quite similar depending on the condition, or irrespective of the condition. It will vary in severity. Okay, so if your cough is so bad that you've developed a fever, you are essentially bedbound, then obviously this will be very difficult to continue the various rituals of Hajj. So as long as you've done the fara'id, so hopefully you've caught it after Arafah, then inshallah anything beyond that can be made up. If it's a mild cough that you've developed, then again, we would encourage wearing a face mask, taking all the necessary precautions so that others around you are not infected. And like we mentioned in the presentation, making sure that when you're not actively engaging in the rituals, that you're having plenty of rest, you're having plenty of fluids and plenty of analgesia, so paracetamol and the like, to just help you get over that and allow you to complete whatever is left of the Hajj, inshallah.
Thank you for that. One for you, Dr. Hina. In the Mina camp, especially for the sisters, are they going to have enough toilets? I've heard some horror stories, and I think often because of these horror stories that people have heard, they don't take the liquids, or they're not drinking enough water to avoid going to the toilets.
Yeah, absolutely. And what I've been told is that the toilets have been significantly revamped since COVID, and they are 5-star quality. So there should be no reason for you to avoid the toilets. What I would say is that please make sure that you plan, wudu in advance of Salah times, because that is when it tends to get very, very busy. So try and go before. But just for general use, it's not a problem. They are clean, they are scented, they have been refurbished. So please make sure that you don't delay going to the toilet because you're worried about the toilet situation, because like I mentioned earlier, that can then increase your risk of getting urine infections.
Thank you. Dr. Boussad, I think we mentioned this earlier, but the facilities for the pilgrims free in Saudi Arabia, the access to hospitals and clinics?
Yeah, in case any Hajj is in need for medical attention, that can be provided free of charge. And you have those volunteers, as you mentioned, throughout the Arafat, Mina, and Muzdalifah. They will be always, roaming around in case their help is needed. And even, if may God forbid they are in severe need for medical attention, things will be taken into account. The needed help will be provided. As Dr. Mohammed also shared the number for the what is it, the Red Crescent there. So they even can put ambulance cars for people who are in huge need for medical attention, just to make sure even if it gets too bad, they will make sure as much as they can that they help you complete your Hajj journey successfully and in a healthy situation. So that shouldn't be something that you worry about.
Okay, thank you. One for you, Dr. El-bayouk. What supplements are recommended to take apart from electrolytes, e.g., vitamin C, magnesium, etc.?
So, mashallah, it sounds like whoever asked that question has already got a pretty comprehensive list. I wouldn't actually add much to that. Just make sure that you're taking your regular medication if needed, staying hydrated. And Hajj in and of itself, yes, it's very physically demanding, but it's actually a short period of time. So inshallah, unless you already have certain deficiencies that have been highlighted to you by your GP or your regular doctor, then I don't see any need to add any further supplements to that. You should be fine, inshallah.
Okay. There's a couple of questions for Dr. Hina here. There's a sister who's completed Umrah twice, but each time struggled with side effects associated with taking period delaying tablets. How can she manage these symptoms whilst on Hajj?
So side effects from period delay tablets are not uncommon. And it really does depend on the type of side effects that you're having. So there are lots of different options. I know often we just think about northisterone, which is the commonest tablet that is prescribed. There are alternative options as well. And you may want to discuss these with your GP or family planning clinic, where you can directly book appointments into without actually needing a referral from the GP. But there are other options as well. It just depends on the nature of the side effects that you're getting.
And the follow-up question is, somebody's confirmed with their GP that they've had the meningitis vaccine. However, they will only be providing them with a certificate, an A4 letter with the NHS number and vaccine details. Will that be acceptable as proof of immunization? I think so.
I'm not too sure about that, to be honest. That would depend on what the authorities require in terms of certification. But if that's what they're offering, then I think you would probably need to just check with your Hajj operator to see if that is acceptable.
Yeah, so long as you've got something that says you've been vaccinated and it's within date, then it should be fine. But again, like Dr. Hina mentioned, check with your operator as well. This is an open-ended one to any of our panelists. Someone's father has kidney failure and mitral valve disease. What should he be careful about? That's for any of our panelists.
I can answer that. That's fine. That really depends on how severe the kidney disease is, and also the mitral valve disease. So at the very low end, it might be mild, no symptoms. So that wouldn't really cause a problem. The main thing would be just make sure that you pace yourself, drink lots of fluids. But obviously, if you're under specialist care, and for anyone who is under any specialist care for any condition, I would say please always make sure that you check with your specialist about any precautions that you may need to take. So whether that's a cardiologist or renal physician, if you are under their care.
And someone's asking the diabetic, and how do they store insulin and maintain temperature control in Mina? Well, they've got some fridges as well, where they normally store your cold water. You could potentially use that. But I think one of the slides we saw was a pouch, the Frio pouch that they could use if any of our doctors want to elaborate on that.
Yeah, so the free patch will or the pouch will essentially allow the insulin to be stored temporarily, but you know, if it's short-acting or fast-acting insulin, then it should be okay outside of a refrigerator for up to 28 days, as far as I'm aware, and Dr. Hina can correct me if I'm wrong. Likewise, Dr. Busad. So that shouldn't be a problem, to be honest, as long as it doesn't get you know, exposed to direct sun or heat, and it's within that pouch, it should be okay. Shouldn't be a problem with that.
That's great. One for you, Dr. Hina. Someone's doctor doesn't recommend prescribing antibiotics because it may cause dependency or reduce immune. Should they take antibiotic prior to Hajj? Why would they?
Yeah, there's no reason to take antibiotics prior to Hajj. You know, it's not given for precaution, it's given for treatment. So if you have an active infection that requires antibiotics, that's different. And I'm sure your doctor will recommend the most appropriate one for you, but we don't advise taking blanket antibiotics just as a precautionary measure. That's definitely not advised.
MashaAllah, one, we're on time, and the other is we've got a very active audience as well, so they're firing a lot of questions. If anybody wants to ask a question live, just raise your hand, and inshallah we'll get you on there. Tasnim, is there anything you want to add whilst I quickly screen some of these questions?
Yeah, I think it's been mentioned with on some of the presentations already, but I picked up on one question. I think a sister recently found out she's expecting, alhamdulillah, and she's asking if there's any special provisions that she can take for pregnant ladies at Hajj. I'd open that up to any of the doctors here to answer that.
Yeah, I can start, and then feel free to add anything, Dr. El-bayouk and Dr. Busad. So firstly, congratulations, mashallah. I hope the pregnancy goes well. Now, in terms of going on the Hajj, there are a few things that I would recommend. So the first is make sure that you make an appointment with your GP as soon as you can, just so you can have a health check and discuss any issues in the pregnancy that might need to be taken into consideration. The second is in many places you can self-refer yourself directly to the antenatal clinic. And so I would advise that you do that, because when you're traveling, your first antenatal appointment that usually occurs between 10 to 13 weeks may fall into the period that you're away. So it's important for your midwifery team to be aware of your travel dates. So if you're able to do that yourself, then that's great. If not, your GP can refer you. And thirdly, make sure that you are taking folic acid and vitamin D, keeping physically active, and you know, looking after your health in general, as you would whether or not you were going for Hajj.
Okay, Jazakallah. I think another question was from an anonymous attendee is it allowed to wear a face mask when in ihram? I don't know if that's so much a health question, but maybe they want to be more preventative.
I think one of the conditions during ihram is that the face should be, you know, you shouldn't cover your face. But this is one I would say more for our sheikh, and I would say if they're attending our seminar this Saturday in London, then Sheikh Yunus will be there to provide an answer to that one in more depth. But I guess if there's a medical need, then there may be some exceptions there as well. If any of our panelists want to add to that. Okay.
I don't know if the person who's asking this question is asking for a medical opinion or like, you know, fiqh opinion. So that part we would leave it to your sheikh. But medically it is very recommended because it is an important preventive measure. And I won't give you the fatwa, but you can get back to your sheikh. But as far as I know, that's not a problem because it's not tailored to fit a certain part of your body. It is just, you know, to cover your face, you know, overall.
Somebody's asking for recommendation on a good brand of unscented sunscreen. I've not used one, so.
I think I typed that answer in, but it doesn't seem to have gone through. So I said that there are lots of different options available. You can just go to Superdrug, Boots, there's La Roche-Posay, Bondi Sands, even Tesco have their own brand of unscented sunscreen. So yeah, lots of options. There are some Islamic shops as well that also in preparation for Hajj sell unscented sunscreen. So yeah, lots of options around.
Brilliant. Apart from the meningitis vaccine, how necessary is it to have the other vaccines, such as tetanus, hepatitis, or any other for that matter? So meningitis is mandatory. Without that, you won't be able to board your flight. But just as a health precaution.
So to be honest, most people would have taken a hepatitis injection at some point in their life. Tetanus and the others, I think the COVID vaccine is also on the recommended list, the flu vaccine. Some vaccines would be recommended depending on whether or not you have underlying health conditions. So if someone has, for example, heart failure or another chronic condition, then they would be more recommended to take some of these other optional ones. Again, that would go back to your discussions and your consultation with your GP and what they recommend for you. So it depends, it's entirely dependent on your health, if you have any chronic conditions in the background, and your discussion and consultation with your doctor.
Right. There's a question in, can a diabetic take rehydration sachets? Are there low sugar ones available?
I don't actually know the answer to that one, to be honest. What would be helpful is actually if you go to your pharmacist. So if you're going to pharmacy and you get the oral rehydration sachets and just ask the pharmacist, they'll be able to tell you on what options are available for you.
Okay. Nice simple answer there. Someone's booked an appointment with their GP to receive meningitis vaccine and for their wife as well. Will that be enough? Well, that's a mandatory requirement. His wife refuses to get other vaccines such as COVID as well as flu shots. I don't think that's mandatory.
No, so I think same answer as the previous question. Make sure you get the mandatory one so that you can complete your Hajj. And as for the recommended ones, then again, it goes back to your individual circumstances and your background health. So remember that you will be around millions of people. Like we said in the presentations, it's very close proximity. So bear that in mind, inshallah. Have a discussion with your GP if you have any particular concerns regarding any vaccines, and they can address those concerns and worries. But don't hesitate, inshallah, because it's for your own benefit.
Just one little piece to add here regarding the meningitis vaccine, that it is required that all Hajjis take it at least 10 days before their arrival to Mecca. So just make sure that the date stamp on your certificate shows that.
Very good point there. Yeah, that's bare minimum requirement. One last question: is malaria needed?
Malaria prophylaxis. So the answer is no, it shouldn't do. The climate in Saudi Arabia is a very hot and dry one, and that's not typical for malaria to exist in such a condition. So inshallah, you don't need to worry about it.
Yeah.
Saudi is declared as a malaria-free region, except if you go to some southern places that are very hard to get to. So I don't think that should be an issue.
No. I think we've come to the end of the session. Any last questions, anyone?
And there's another question here which says, does Nusuk refund pilgrims in case of hospitalization before departure for Hajj?
I think they have their policies and regulations. You better check their website because I think they have a sort of prorated refund to how late you cancel your Hajj reservation. So take that into account. And just one last piece I wanted to add to the brothers and sisters who are asking about some issues related to diabetes that, as you all mentioned, this is a physically demanding journey. You'll be doing a lot of walking. For those who are diabetic, make sure that you choose the proper, shoes for your, and be careful while you're walking, not to get injured, or check them every now and then just to make sure in case any little wound there, it can become worse and worse if you don't pay good attention to it. Receive any medical care needed for your condition. Don't just ignore it and overlook it. Yeah.
I was just wondering if any of you had any final words for our attendees that may benefit them before they go to Hajj as we wrap up, inshallah.
Hydration and physical activity. Get yourself prepared.
Dr. Shahid?
I would say that if you have any health concerns, then please make sure that you speak to your GP well in advance.
Jazakallah khair. And Dr. El-bayouk?
All I can say is I'm very excited for each and every one of you. So ask Allah subhanahu wa ta'ala to make it an easy and accepted and blessed journey. And just remember that the more you take care of your health, the more available spiritually you'll be. You can focus on that side of things. If the health side of things is sorted, then you can focus on the spiritual aspect a lot more. So don't neglect it. Follow the advice of your doctors, the advice given in this presentation, and so much more, and seek help when needed.
Fantastic, mashallah. I just would like to thank each and every one of you for giving such beneficial advice to those who are embarking on such a beautiful and spiritual journey to Hajj, inshallah. May Allah bless everybody who's going to be going to Allah subhanahu wa ta'ala's house. And also, I'd just like to remind everyone that on Saturday we have the annual Hajj seminar at East London Mosque. So inshallah, we look forward to seeing many of you there to find out more. We have Sheikh Yunus, who will be able to be on hand to answer any questions and talk more about the fiqh side of Hajj, inshallah. Now I'll hand over to Brother Rashid to give just a final wrap up, and thank you all so much again.
Thank you, Tasnim. Just thanks and appreciation to all our partners and our doctors this evening for making it one of our better and best webinar on health at Hajj. I hope you found it informative, and inshallah the advice that's been given will make your Hajj an easy one, inshallah, we pray. We ask you that you remember us in your prayers as well. I can see Dr. Mohamed Zamzami in as a participant. He's the president and the of the Saudi Medical Association for Volunteers. I'm going to put him on the spot and ask him if he's got a few words to say. Assalamu alaikum.
Alaikum assalam wa rahmatullahi wa barakatuh.
How are you? And thank you for honoring us in this webinar. A few years ago, we were blessed to have worked with you in the days of Hajj, actually. Could we see some kind of collaboration again this year for your volunteers and the doctors to be helping our British Hajjis at Hajj, inshallah?
Inshallah ta'ala, and jazakumullah khair for your activity to educate your pilgrims and also to make a chance for us to contribute in this journey regarding SMAF, which is Saudi Medical Academy for Volunteers. Our speaker today, Dr. Boussaad, and thank you for him for attendance and participate. Regarding our collaboration, I think it's amazing, and I think it's role model for all Hajj community around the world. So might be we can collaborate and we can educate, we can innovate multi initiatives for our pilgrims, and also I can introduce some of our participation in research community for medical student who's willing to volunteer with us overseas to educate the pilgrims outside. And we take offer, inshallah ta'ala, once you arrive to Saudi Arabia, to conduct some health education on-site visit. And also you will find us around Jabal al-Rahma and in the route to provide on-site medical care for our pilgrims. Thank you so much.
Thank you again. And I invite Dr. Hina to bring the Muslim Doctors Association to collaborate as well with the Saudi medical team. The amazing work. We were on the ground as well. It is intense. It's never easy. But alhamdulillah, with the advice that you have been given this evening, your Hajj is going to be that little bit easy, inshallah. So Jazakallah khair to Dr. Hina, Dr. Mohammed El-bayouk, Dr. Mohammed Bousad, Tasnim for being a great host, and Brother Shamim for his support as well. And remember us all in your du'as, and inshallah we'll see you on Saturday. Jazakallah khair. Assalamu alaikum wa rahmatullahi wa barakatuh.
Jazakallah khair. Assalamu alaikum.